Welcome to the examination orientation. Our goal for this orientation is to help you understand each component of the Alberta Acupuncture registration examinations. We will cover the exam structure, format, and essential tips to help you prepare for the exams. If you have any questions after this orientation, please check the AARE Frequently Asked Questions page available on our website. If the questions and answers on that page do not address your question, please feel free to reach out to us via email at info@acupuncturealberta.ca. We're always available to address any concerns you may have. Any new questions received will be added to the Frequently Asked Questions page on our website. Before we get into the orientation material, I want to briefly introduce the college. The college's role is to serve the public interest by ensuring ethical, safe, and competent care by our registrants. Passing the registration examinations is one requirement of the college to ensure registrants meet the entry-level competencies and are able to provide safe and quality care to the public. The college sets minimum standards of practice, ensures registration requirements are met, and enforces discipline. Registrants are expected to know and follow the standards of competency and practice, code of professional conduct, policies, and guidelines. It is strongly recommended that you review these documents carefully before you become registered with the college. We will not delve into the specifics of the legislation and regulations at this time, but it is important to note that acupuncturist is a protected title and acupuncture is a restricted activity. Acupuncture students or graduates are not allowed to hold themselves out as acupuncturists and cannot practice or perform acupuncture needling outside of student clinics. The Alberta Acupuncture registration examinations consist of 4 components. The examination date for each component is available on our website on our exams page. It is essential that you are available on those dates. You should receive information about your Pan-Canadian exam and your exam schedule for the safety, modalities, and acupuncture points exam via email. For an estimated timeline on when to expect this information, please visit our website. To ensure you do not miss any important information, please check your email regularly during this time, including your spam and junk folder. Pan-Canadian examination is a computer-based test. You will take this exam at a testing center located in a city of your preference. This exam is made up of 2 components. The first component consists of 125 multiple-choice questions. You will have 2.5 hours to complete it. The second component is made up of 40 clinical case questions. The 40 questions will be made up of multiple choice and multiple select questions. You will also have 2.5 hours to complete this test. To ensure the health and safety of all participants for the modalities exam, you must extinguish the flame used for Step 3 fire cupping over a needle using the water container provided. For the acupuncture points exam, you will not be asked to locate acupuncture points around the standardized patient's mouth, nose, eye, genitals, and anus. Please note that you must bring your own measurement tools, such as an elastic, string, or a Soon ruler. The modalities exam tests your hands-on skill for infection prevention and control, and 3 different acupuncture techniques. You'll be required to set up your equipment and supplies and demonstrate acupuncture, moxa on a needle, and fire cupping over a needle. A manual of acupuncture by Peter Deadman is the only reference text for the modalities exam. You must demonstrate needling depth, angle, and direction according to the Deadman textbook. Exam time for the modalities exam is 18 minutes. The exam time for the acupuncture points exam is 16 minutes. There will be a timer in each exam room, so you will be aware of how much time is left for your exam. Examiners will confirm the size of the needle you are using for Step 1 acupuncture, and they will also use a protractor to measure your needling angle after you've completed insertion of the needle for this step. When you enter the modalities exam room, there will be one examiner. Your examiner will ask for your candidate ID, which is adhered to your shirt or lab coat. Please do not say your name in the exam room in order to avoid bias. On the counter, you will see a copy of the instructions and one candidate worksheet on a clipboard with a pencil. You are welcome to put your kit on the same counter space, but the examiners will prompt you to set up your supplies. You are welcome to take a moment to read over the worksheet. You can use this worksheet to prepare your plan and make notes. The worksheet is for your own use and will not be graded, but you will have to leave it in the exam room for confidentiality purposes. The examiners will prompt you through the exam. Please do not jump ahead a section. Instead, wait for the next prompt. On page C6, you will find all of the prompts. You will be tested in the same order. Practicing with these prompts until you're comfortable with them is strongly recommended. Some tips for this exam. Treat the mannequin as a 165-pound, 75-kilogram male model and keep this in mind for your needling depth. Use the general body areas of the foam mannequin that correspond to the acupuncture point to insert your needle. This is not an acupuncture points exam, but you will need to know the general location of the acupuncture point. The examiners are trained to pay attention to your infection prevention and control skills, so you must verbalize every instance of hand washing. Come with your acupuncture kit organized, as it will be to your benefit. Do not overcomplicate your kit and bring only what's necessary for your exam. Your acupuncture kit will not be scored. Candidates typically blow off the flame for the fire cupping step. To reduce disease transmission, you must extinguish the flame in the container of water provided. The container will be colored and labeled water. Do not put your isopropyl alcohol next to the water. In the past, candidates have mixed up the containers and attempted to put the flame into the isopropyl alcohol container. Do not perform the cupping step on the foam mannequin. Cups will not adhere. Instead, perform your cupping step on the high-density pad. If you make a mistake, verbalize how you would correct it, and if possible for that section, redo the step. You may be able to earn back some points depending on when you make the correction. The exception to this is critical errors. Critical errors cannot be corrected at a later time. Finally, we understand that you may be anxious, and you may ask your examiner how well you are doing, but the examiner cannot answer that question. The modalities exam has a critical error component. If you make a critical error during the exam, you will receive an automatic fail. Critical errors are a failure to mention hand washing more than once, a failure to demonstrate or mention glove use when your hands show lesions, rashes, etc., inserting a needle too deeply or at an incorrect angle or direction in an area that could damage the heart, lungs, or central nervous system, failing to use a heat shield while performing moxibustion, dropping burning moxa onto the patient. Unsafe needling at an area that could damage the heart, lungs, or central nervous system is the most common critical error made by candidates. Examples on what constitute a critical error are inserting a needle too deeply, even if you demonstrated appropriate needling angle and direction. Inserting a needle with an incorrect angle, even if you demonstrated appropriate needling depth and direction. Inserting a needle at an incorrect direction, even if you demonstrated appropriate needling angle and depth. If you verbalize correct techniques but demonstrate inappropriate needling, it is a critical error. Note that the examiners assess your needling demonstration and not your verbalization. This is a picture of the foam mannequin and high-density pad. You will treat the mannequin as a live patient. The foam mannequin provides a soft and generally loose feeling for inserting a needle, while the high-density pad provides a firm and generally tight feeling. Both would protect the angle and depth of the needle. For example, if you insert a needle obliquely with a certain depth, it will stay in that position. You are welcome to use either the mannequin or the high-density pad for steps 1 and 2. But you must use the high-density pad for step 3, fire cupping over a needle, because cups cannot achieve suction on the mannequin. If you make an error during the modalities exam, your score is severely reduced. Receiving a low score for this exam is often due to making too many errors. You should review the AARE Candidate Handbook pages C7 and C8 for a full list of errors. Some commonly made errors include a compromised clean field, failure to mention hand washing, unsafe removal of moxicone, inappropriate alcohol swabbing, and holding a flame directly over or too close to the patient's body. The acupuncture points exam has a practical component and a written component. You will be required to locate 8 different acupuncture points using adhesive dots on a real person, and you'll also need to identify the precautions and contradictions for each acupuncture point on the answer sheet. The acupuncture points exam also has a critical error component. You must identify the risk of injuring the lungs, central nervous system, and heart of an acupuncture point. A failure to do so is considered a critical error and will result in an automatic failure. Similar to the modalities exam, the acupuncture points exam uses a manual of acupuncture by Peter Deadman as the only reference text. You will locate the points and identify the precautions and contradictions according to the Deadman textbook. Examiners will use a timer to track your exam time. The timer will be put at a place where you can see the remaining time of the exam. You're encouraged to carefully review page D2 of the Candidate Handbook. The general guidelines and tips have valuable information for you to be successful at the acupuncture points exam. Some tips include, in order to save time, acupuncture points should be grouped according to their body positions. For example, locate all the supine acupuncture points first, then ask a patient to turn to a prone position to locate the rest of the acupuncture points. You're encouraged to use adhesive dots for temporary marking to improve accuracy, but you must remove all the temporary dots before the exam is concluded to prevent any confusion. When locating an acupuncture point, you should always use anatomical landmark descriptions if they are available. For example, lung 2 should be located by finding the center of the hollow of the deltal pectoral triangle, not by measuring 6 cun lateral to the midline. You should use appropriate proportional cun measurements to locate an acupuncture point. For example, you should use the lateral border of the rectus abdominis muscle to find the 4 cun distance for acupuncture points such as spleen 15. It is inaccurate to use the chest cun measurements or use quick cun measurements to find abdominal points. Some acupuncture points are located by putting patients into the essential body positioning. For example, for small intestine 19, you must place the dot with the patient's mouth open. For each failed essential body position required for needling, you lose 50% of the marks you have earned from that acupuncture point location. Some extra points, such as Lan Wei, require verbal interaction with the patients to correctly locate them. If you locate such points without verbal interaction, you lose 50% of the marks you have earned from that acupuncture point location. Please be considerate and do not use sharp objects to press or leave marks on your standardized patient. You should locate acupuncture points in a body position that allows full and easy access to the point that is safe and comfortable for your patient. It is recommended that you use a manual of acupuncture by Peter Deadman and its videos to study for appropriate body positioning. This is an example of your worksheet. You must correctly identify the precautions and contraindications for each acupuncture point. If an acupuncture point has no specific precautions or contraindications, you must check off no precautions contraindications. Checking more responses than expected number of responses will not affect your marks as long as they are all correct. For example, gallbladder 21 has 2 expected responses. However, if you check off contraindication in pregnancy, other avoid lungs, and no deep perpendicular needling for a total of 3 responses, you still receive full marks because they are all correct answers. Notice that there are different ways of filling out the precautions and contraindications. For example, you can check off no deep perpendicular needling, or check off other and write down avoid lungs for gallbladder 21. Both responses are considered correct. In addition, for gallbladder 21, you must identify its potential risk of injuring the lungs with deep needling. If you don't check off no deep perpendicular needling or check off other and write down avoid lungs, it is considered a critical error. Thank you for watching the orientation video. We wish you all the best in your exams. Remember to check the description box below for links to the resources mentioned in this video.